If you've been told you have high blood pressure, you might be wondering if the foods you eat have something to do with it. The truth is, yes, they do. What we eat can really influence our blood pressure. In fact, by just changing their diet, some older individuals have been able to manage their blood pressure better, sometimes even reducing the need for medication. So, what about salt? How does it relate to high blood pressure? Salt, which contains a lot of sodium, is known to increase blood pressure. The Centers for Disease Control and Prevention points out that many people eat more salt than they should. There are guidelines that suggest adults should limit their sodium intake to less than 2,300 mg per day. But if you're someone with high blood pressure, it's even more crucial to cut back, aiming for no more than 1,500 mg daily. But it's not just about reducing salt. To really take care of your heart and lower the chances of issues like heart attacks or strokes, it's essential to eat foods that are good for maintaining healthy blood pressure. This means including more fresh fruits, vegetables, and whole grains in your diet and being mindful of your overall food choices. But worry not, today at HealthBeam we have picked the 6 superfoods that will help you reduce blood pressure instantly. Remember that this video is for educational purposes only and not as a medium to replace your doctors and dietitians. 1. Unsweetened yogurt. Yogurt is one option which can help you in controlling blood pressure numbers. Yogurt is extremely healthy, which can be added to your diet, and it can help you with managing blood pressure numbers as well. A study presented at the American Heart Association's Epidemiology and Lifestyle in 2016 also found that people who consumed 5 or more servings of yogurt throughout the week were at a lower risk of developing high blood pressure. Yogurt can be added to your daily diet. It will provide you some essential nutrients. Yogurt contains vitamin B12, calcium, and phosphorus. It is also a source of protein. Probiotic property of yogurt is also beneficial for health as it improves your digestive health, boosts immunity, and many more. Also, your average yogurt contains a mix of minerals that help regulate blood pressure: calcium, magnesium, and potassium. Each one of these 3 minerals plays an important role in managing blood flow throughout the body. Potassium helps relax the walls of your blood vessels, which lowers blood pressure. Magnesium regulates blood pressure as well as blood sugar levels, and like potassium, it relaxes the blood vessels. And calcium is involved in the process of blood vessels constricting and relaxing, helping them function smoothly. Some strains of lactic acid bacteria found in fermented yogurt can produce peptides that have ACE inhibitory activity. ACE inhibitory, a class of drugs commonly prescribed to treat high blood pressure. By inhibiting ACE, these peptides can help relax blood vessels and reduce blood pressure. Some studies have shown that regular consumption of yogurt can lead to improved blood lipid profiles, including reduced levels of LLAD or cholesterol. So start infusing yogurt in your diet from today itself. 2. Berries. Berries such as strawberries, blueberries, and raspberries are not just delicious fruits. They are also packed with an array of bioactive compounds that have been scientifically linked to cardiovascular health. High blood pressure or hypertension is a major risk factor for heart diseases, and incorporating berries into one's diet can play a role in its management. One of the primary compounds in berries responsible for their blood pressure lowering effects is flavonoids. Flavonoids are a group of polyphenolic compounds that have antioxidant properties. Specifically, a subtype of flavonoids called anthocyanins, which give berries their vibrant colors, has been shown to relax blood vessels. This relaxation facilitates smoother blood flow and reduces the resistance against which the heart has to pump, leading to a decrease in blood pressure. Furthermore, flavonoids help combat oxidative stress, a condition that can damage blood vessels and contribute to hypertension. The endothelium is the inner lining of blood vessels, playing a crucial role in maintaining vascular health and regulating blood pressure. Berries have been shown to improve endothelial function primarily due to their high content of vitamins and antioxidants. These compounds enhance the production of nitric oxide, a molecule that signals blood vessels to relax and dilate. Improved endothelial function means that blood vessels can better adapt to changes in blood flow, thereby aiding in the prevention and reduction of high blood pressure. 3. Beets. Beets, scientifically known as Beta vulgaris, are root vegetables that have garnered attention in the health community for their potential cardiovascular benefits. High blood pressure is a prevalent concern worldwide, and dietary interventions such as the inclusion of beets can offer a natural approach to its management. The blood pressure lowering properties of beets can be attributed to their rich content of nitrates and other beneficial compounds. The primary mechanism through which beets influence blood pressure is their high dietary nitrate content. When consumed, these nitrates are converted into nitrites by the bacteria in our mouths. As these nitrites travel through the digestive system and enter the bloodstream, they are further transformed into nitric oxide, a potent vasodilator. Nitric oxide signals the blood vessels to relax and expand, facilitating improved blood flow and, consequently, leading to a reduction in blood pressure. This natural vasodilation process is especially beneficial for those with hypertension, as it aids in alleviating the pressure against arterial walls. Beyond just nitrates, beets are also packed with betalains, which are pigments responsible for their deep red color. These betalains possess antioxidant properties, helping to combat oxidative stress that can damage blood vessels and contribute to cardiovascular diseases. Additionally, the fiber content in beets supports healthy digestion and aids in the removal of cholesterol from the body, further promoting heart health. 4. Sweet potatoes. Sweet potatoes, known scientifically as Ipomoea batatas, are nutrient-dense tumors that have been a staple in many traditional diets around the world. Their rich array of vitamins, minerals, and phytonutrients make them a valuable food for various health benefits, including the potential to assist in regulating blood pressure. Understanding the relationship between sweet potatoes and blood pressure requires a closer look at their nutritional profile and the mechanisms through which these nutrients exert their effects. One of the standout nutrients in sweet potatoes that plays a pivotal role in blood pressure regulation is potassium. Potassium is an essential mineral that counteracts the effects of sodium in the body. While excessive sodium can lead to water retention and increased blood pressure, potassium helps balance this by promoting the excretion of sodium through urine and relaxing the walls of blood vessels. By aiding in the maintenance of proper sodium-potassium balance in cells, sweet potatoes can contribute to the prevention and management of hypertension. Beyond potassium, sweet potatoes are also rich in dietary fiber, particularly soluble fiber. This type of fiber assists in reducing the levels of bad cholesterol in the blood, which, when elevated, can lead to atherosclerosis and increased blood pressure. Additionally, the vibrant orange color of many sweet potato varieties indicates a high content of beta-carotene, a powerful antioxidant. Antioxidants like beta-carotene combat oxidative stress, a condition that can damage blood vessels and contribute to the progression of high blood pressure. In essence, the combined effects of fiber and antioxidants in sweet potatoes offer a holistic approach to cardiovascular health making them a worthy addition to a balanced diet. 5. Leafy greens. Leafy greens, encompassing vegetables such as spinach, kale, Swiss chard, and collard greens, are celebrated cornerstones of a healthful diet. These verdant vegetables are packed with a plethora of nutrients and bioactive compounds that have been linked to a myriad of health benefits, including the potential to positively influence blood pressure. To appreciate the role of leafy greens in blood pressure management, it's essential to delve into their nutrient composition and the associated physiological effects. Central to the blood pressure lowering properties of leafy greens is their abundant potassium content. Potassium serves as a counterbalance to sodium in the body. While high sodium levels can elevate blood pressure by causing the body to retain water and by constricting blood vessels, potassium works in opposition. It aids in the relaxation of blood vessel walls and encourages the kidneys to excrete excess sodium, thereby reducing blood volume and pressure. Regular consumption of potassium-rich leafy greens can assist in maintaining an optimal sodium-potassium balance, which is crucial for blood pressure regulation. Beyond potassium, leafy greens are a treasure trove of other beneficial compounds. They are rich in magnesium, another mineral that aids in blood vessel relaxation and has been linked to lower blood pressure levels. Additionally, the high dietary fiber content in these vegetables supports heart health by helping to lower LDL cholesterol, a contributing factor to hypertension. Furthermore, the chlorophyll, flavonoids, and other antioxidants present in leafy greens combat oxidative stress, which can damage blood vessels and exacerbate high blood pressure. 6. Fatty fish. Fatty fish, including salmon, mackerel, sardines, and trout, are renowned for their exceptional nutritional profile and their role in promoting cardiovascular health. These fish are particularly esteemed for their high content of omega-3 fatty acids, which have been extensively studied for their potential to modulate blood pressure. To understand the relationship between fatty fish consumption and blood pressure regulation, it's crucial to explore the underlying mechanisms of omega-3 fatty acids and other beneficial components found in these fish. The primary agents responsible for the blood pressure lowering effects of fatty fish are the omega-3 fatty acids, specifically eicosapentaenoic acid, or EPA, and docosahexaenoic acid, or DHA. These fatty acids have multiple cardiovascular benefits, one of which is their ability to improve blood vessel elasticity. Enhanced vessel elasticity allows for better accommodation of blood flow, leading to reduced blood pressure. Additionally, omega-3s exhibit anti-inflammatory properties, which can mitigate inflammation in the blood vessels, a factor that can contribute to hypertension. Furthermore, these fatty acids can reduce blood clotting and decrease the production of certain substances that constrict blood vessels, further aiding in blood pressure regulation. Beyond omega-3 fatty acids, fatty fish are also a good source of vitamin D, which has been linked to optimal blood pressure levels and overall cardiovascular health. Moreover, the protein content in fatty fish can contribute to improved arterial function and reduced arterial stiffness, both of which are beneficial for maintaining healthy blood pressure. It's also worth noting that replacing red meat, which often contains higher levels of saturated fats, with fatty fish in one's diet can lead to a more favorable lipid profile, further promoting heart health. In conclusion, incorporating fatty fish into one's dietary regimen offers a multifaceted approach to blood pressure management and broader cardiovascular well-being.